So I'm Dr. Jason Markle. I've been here since 2014, 2015, did an interventional orthopedic fellowship here at Centeno Schultz Clinic. Centeno Schultz and Regenexx, this is actually the epicenter of all of orthobiologics in the United States. This is the clinical headquarters. It all started here. Dr. Centeno, Dr. Schultz, as well as Dr. Pitts and myself, we all started all these treatment options before anybody else really started using them. So we've done it for the longest, as well as we train physicians how to do this. A lot of physicians nowadays are actually doing regenerative medicine in orthobiologics. So if we look at the details of what makes Regenexx different, one, from the diagnosis, we spend a comprehensive examination. Two, what we inject. The biologics that we inject are high quality, high concentration PRP. We have a laboratory that can tailor make our platelets to treat whatever we're treating, whether it be nerve, tendon, ligaments, joints. We have different combinations and formulations to treat those specifically. And then how we inject it. We inject it specifically with image guidance, as well as comprehensive, taking an interventional orthopedic approach, which very few physicians around the country as well as the world really utilize that high level of care. So we're very different from other physicians. My philosophy of the treatment is more of a holistic treatment. So as a physiatrist, we're sort of trained to look at the whole body. So for an instance, if we're looking at the knee, for example, so knee pain, so we're going to evaluate your low back, your hip, and your ankle in addition to your knee and take a full history and find out all the details about that injury and relate that when we examine you to see if there's any coexisting or also related problems above and below that it could be related to your knee problem. And then come up with a holistic treatment option and that's very comprehensive to make sure we're addressing not only your pain, but also the underlying issues that could have led to that. Procedural days are always going to be a long day. You're going to get a blood draw, and that takes a couple hours of process, and then we do the treatment. Treatment's going to be a very comprehensive treatment where we're going to use multiple modalities from ultrasound guidance, x-ray guidance, and have you in several different positions. We're numbing it up as we go, or sometimes even using some conscious sedation. Typically, procedure lasts anywhere from 30 minutes to an hour and a half. And then afterwards, we can expect some soreness, some swelling in the areas that were injected, and that will calm down over the first several days. Recovery time can vary. It can vary from a few days to 2 to 4 weeks. All depends on what we're treating, and your physician will sort of go over those expectations with you specifically.